Pharmacist Titi, I brought my
Yeah,
prescription. I hope that prescription, I hope it's not antibiotics the doctor wrote for me. Oh.
it's actually antibiotics, so even
You say
ampiclox,
what?
we take ampiclox. Ampiclox.
I won't take it. Oh no. Why? Well, as you know, I know nobody will say it to my face, but I know, as you know, I'm thin. More theory,
Hmm.
more theory. And I cannot take antibiotic that will now suck my blood, reduce my blood volume. Kinwa therapy. No, I won't take it. Oh, I won't. How many times did they say I should take it in a day?
Your doctor prescribed one every 6 hours. That's 4 times a day, and for 5 days.
Not me. So what I would do is I would take it
Okay.
once a day. That for a day, yeah. So if I reduce the number of times I take it in a day, maybe it will even help with the blood not reducing. And then on top of that, I will take blood tonic. So what I would do, you can fill the prescription for me. I will take that plus I will take it once a day plus blood tonic. That's my final decision because I can't lose any more blood. I'm too thin for that. Thank you.
That's your final decision.
Well,
Hmm.
let's be real. Let's be real. Like you and I are pharmacists, right? We see that
Yes.
every now and then, people thinking, oh, um, antibiotics will reduce my blood volume. It will cause blood thinning, it will make me weak, make me sick. What's your take on that? Do antibiotics really reduce our blood volume?
Mm. Well, the general answer to that question, I would say, is no. And naturally, people feel like when they are on antibiotics, they get weak. And this is normal. That is why when your pharmacist or doctor prescribe a drug for you, they would also tell you to get adequate rest. But people hardly do that. They believe in hustling even while they are sick. So because of this, the immune system gets weak and naturally they will feel weak. So it's important to know that being on antibiotics does not equate to low blood volume. It can make you weak, yes, but it doesn't mean that your blood volume is low. That is not true.
Yeah, I know there are certain medications that even, depending on people's body, some medications can cause some weakness. It just means you need to rest more. So
Yes.
in essence, you're saying that when we take antibiotics and we feel a bit weak, it doesn't mean that our blood volume is low. It's not like linked to that, right? So
Right.
we don't need to use that assumption in making decisions about antibiotics and blood tonics.
Yes.
Well, that makes sense. That makes sense. Especially here, as you know, and there's one of the things they are keen on here is drug-drug interaction. So many
Very
times when people take a couple of medications, it's one of the things that pharmacists need to check for are there drug-drug interactions with this medication. And as a matter of fact, with many antibiotics, there are interactions with iron, with blood tonics. Um, a person who chooses to take blood tonics or iron with every single antibiotic they use may be doing themselves more harm than good because with certain antibiotics like tetracyclines, doxycycline, even ciprofloxacin, levofloxacin, when you take it concurrently with blood tonics, you're reducing how much your body absorbs, how much of
true.
these antibiotics your body absorbs. So your body doesn't even have enough of these antibiotics to work to kill the infection. So it's really counterproductive.
Mm.
So that's another thing I normally tell my patients, drug-drug interaction, antibiotic, blood tonic, it's real. So we could be doing more harm than good if we insist on taking them together.
The point you just made now also reminds me of antibiotic resistance. Like you said, when a patient take the blood tonic with the antibiotics, it reduces the amount of antibiotics that is actually taken into the bloodstream to work. So normally, just like we mentioned earlier with the patient we had at the beginning, that wanted to take one tablet instead of four daily for 5 days. So if a patient does that, feeling like if I take it how I'm supposed to, my blood volume will reduce. That's wrong because the patient will develop antibiotic resistance with time, such that even the required dosage will not be effective enough. It will not be effective enough to kill the infection. So the patient is causing more harm to their body. It also reminds me of a time when I saw a particular patient report. This patient had uh, an infection and has been using several antibiotics, started with Ampiclox, went to amoxicillin and like that. And there was really no improvement. So the patient was advised to do a sensitivity test, and majority of the antibiotics out there, the patient was resistant to them. Majority of antibiotics in the market. So this patient has developed resistant to various antibiotics, leading it to just now like two. And those two, the patient, it was very expensive for the patient to afford. So in order to avoid certain issues like that, it's best to stick to the dosage that was prescribed by a pharmacist.
What you just said just reminds me of the fact that here in Canada, as you practice pharmacy, one of the things you should know are like there are steps in antibiotic therapy. There's what we call first line, second line, third line. So for certain infections, there's first line medication, second line medication. The medications, the antibiotics they choose as first line, the things they consider are efficacy and safety. Number one, does it work? Number two, what kind of side effects will you get from it? So just imagine them giving a patient, a doctor prescribing to a patient a first line therapy, first line antibiotic like Ampiclox, for example. Ampiclox, it doesn't really give so much serious side effects.
Yeah, that's
It's
true.
it's effective, because it's a combination of ampicillin and cloxacillin, so it helps with ampicillin resistance. But a patient who doesn't take it very well eventually has Ampiclox stops working for him or her, and then they have to go to, let's say they have to go to like third line. Once you're getting to
Mhm.
third line antibiotics, fourth line antibiotics, you're taking antibiotics that are stronger and they cause even more severe side effects. So it's just best when we are prescribed antibiotics to use it the right way. If it's 4 times daily, stick to that. If it's 2 times daily, stick to that. In fact, here it's not just enough to say twice daily. You have to say every 12 hours to show you how
Mm.
specific they are about the timing, just to prevent, antibiotic resistance. So, yeah, it's an important thing to bring up because if antibiotics stop working for you, I mean, it's a sorry case. A person may catch
Yeah,
an infection, there is nothing to cure it, and you know what that leads to. So it's important to watch out for that for sure.
yeah. And another thing to note is in Nigeria today, where I
Mhm.
practice, most people do what they do to themselves, do it to their children. They self-medicate. If you are told to take a particular antibiotics 4 times daily and they feel that they can take one a day and supplement it with a blood tonic to give them strength, they do the same to their children. And at a young age, these children develop antibiotic resistance. Another thing too to note is the level of iron in the blood tonic that is needed for a child is quite different from that needed in an adult. So children easily develop iron poisoning, and this can lead to severe cases and it can even lead to death for that young child. So the parent would indirectly be killing their children without knowing. So please, your children do not need to take blood tonic with antibiotics. If they are sick and they are prescribed a particular medication, let them use it and rest well. That is not the time for them to be playing, following you to the market to hustle. Let them rest well.
Yeah, and even here in Canada, in the pharmacies, in my pharmacy practice, there are medications they call over-the-counter medications. So these are medications that a person can just walk into the pharmacy, pick up themselves, and walk away. But there are other
Mm-hmm.
medications, like we call them Schedule 2 medications.
Okay.
They are kept inside the dispensary, inside the pharmacy. So a pharmacy will have to speak to you. A pharmacist will have to speak to you, assess you to be sure you need that medication before you can take it, and it's okay. So over-the-counter medication that we have for iron, it's very mild, very low dose because like if you
Mm.
take that, it's less likely that you have serious, any fatality. You may get some side effects, but nothing fatal, like not death. But the higher dose of iron, for example, we keep it behind the counter. So if somebody comes and
Mm.
says, "Oh, I need, that high strength of iron," the pharmacist would
Mm-hmm.
normally intervene. Like I would normally intervene. What do you want to use it for? Did the doctor prescribe it for you? Are you pregnant? So
Okay.
you ask questions to be sure that the patient actually needs iron. Because if the
Mm.
patient's iron levels are okay and they take these high dose iron and it gets very high, they could have
Yeah.
iron poisoning. And these are adults, they could have iron poisoning, which could cause some
Mm.
um, you know, let me say detrimental effects in their system. So how much more kids, right? Kids that are even more delicate. So yeah, it's really important that parents are really paying attention to this. Iron is not harmless. You don't just,
That's
give it to your child like that.
yes. And as much as we're trying to create awareness, we know that there are some people that will still do what they are used to do with the belief that nothing doing, I'll be fine. So what will you tell such patients? How should they probably space their the drugs, the medications?
So there are some medications that you need to give at least 2 hours with iron.
Okay.
There are some others you need to give at least 4 hours with iron. So I'll just say if you want to cram this formula, just to be on the safe side, take your iron, supplement your iron tonics at least 4 hours before or after you take your antibiotics, just to be on the safe side. Yeah, like you said, some people will still say, "Oh no, that's my nature. That's what I'm used to. That's how I was raised." So if you want to go that route, to be on the safe side, give 4 hours before or after you take your antibiotics to take your iron.
Mhm. But the actual fact is that it is unnecessary for people
Yeah,
to do that.
I mean,
Exactly.
if it's necessary, our doctors in Nigeria are very knowledgeable. They would not just
Yeah.
prescribe the antibiotic. They will tell you to take iron, but they don't do
Yes.
that. They don't prescribe iron with the antibiotic because they know it's not necessary. It's just like I mean, it's something that is already ingrained in society. I'm not sure of the source, but definitely not from our doctors. So if the doctor feels that you need it, he would have put it in the prescription. So it's not necessary.
Yeah. So thank you. So it's important that we complete our dose and we avoid taking blood supplements like iron, blood iron pills with antibiotics.
Yeah, totally not necessary. Totally not. And then rest well when you're sick. Rest well as you take your medications. Try and eat well. Keep your fluids going. Drink water, and yeah, and get better soon.
Mhm.
Okay, oh, my pharmacist, I've heard of everything you said, the pharmacist. So that my prescription on Ampiclos. Okay, how many hours daily?
Every 6 hours,
So
one every
four
6 hours for 5 days. Yes.
or
So you
five
actually
days.
even need to buy two sachets.
I will buy it so I can get one. So I don't need blood tonic.
You don't. You don't.
Okay, that just give me the Ampiclox. I will take it one every 6 hours. Good. My
Yes.
blood tonic money. I will keep it, Mafireja. I will use it to cook
Yeah,
food. I will eat better food. Thank you very
that's
much.
fine.
I appreciate you. You're always
Okay.
very helpful. Thank you. Okay. Have a good day.